Okay, so what do we know from research on risk and risk perceptions about what influences how someone responds to a risk? So, just to give you a feeling for what we're talking about when we say how someone responds to a risk, think about how you feel when you're embarking on a flight and you're about to get on a plane and you're buckling your seatbelt. Um, what kind of feelings are you having? I'm not sure about you. Not everyone feels the same, but I personally am terrified of flying. It doesn't matter how many people tell me it's a safe form of transportation. I am absolutely terrified to get on a plane and fly. And so I get really scared and I'm really, really anxious. Now, think about that experience versus thinking about how you feel when you get into the car to go down the street to the grocery store to go visit someone in your family. I don't know about you, but I don't feel very scared when I get into a car. I feel more more relaxed, less anxious, and it's just something, it's a habit, it's something that I do all the time. I'm the person in the driver's seat, so it doesn't feel as scary to me. I'm in a car, I'm not floating above the earth at 30,000 feet. So if we stop and we think about those two different scenarios for a second, there's multiple pieces of those situations that affect my, feeling of anxiety around flying versus being in a car. So, through research over probably about 50 or 60 years, we've learned that these factors here that are listed on this slide, which I'll go through some of them a little bit, are factors that influence how people feel about a particular risk. So, trust is one of them. So, if you have a lot of trust in, let's say, your government, you might feel less scared about, in general, about risks that you face in life. If you're embarking on a plane and you know the pilot personally, you know that they have a good record of flight, you're friends with them perhaps, you're probably less likely to be scared about getting on that plane than if you don't know the person who's flying the plane at all. Voluntariness is another factor that impacts how people feel about risk. So typically, the less voluntary that something is, the more scary or the more risky it feels to someone. So again, we volunteer to get in a car every day, but we might not necessarily volunteer. Obviously, getting on a plane is our own choice, but if we want to go overseas, that's our only way to get there versus, I might be able to walk down the street to the grocery store or take a bike or something like that. There's other scenarios, wearing a mask or getting the vaccine. The voluntariness around that also is a good example of impacting how people feel about it. If people feel like it's something that they're being made to do, they might be a little bit more skeptical of it than if they feel like it's something they're doing of their own volition. Controllability is another thing. So similar to the whole plane situation, you're not in control of the person flying the plane. You're not the one flying the plane. So that lack of control over the situation that you're in can make it feel a lot more scary, a lot more risky than it may be. And this feeling of dread, there are certain things that just evoke a sense of dread in us because of a combination of some of these other factors, or because of cultural conversations around particular types of things like nuclear power, for instance. A lot of people might feel a really intense fear about living right next to a nuclear power plant, even though that's a relatively low risk activity compared to driving in a car, for instance. But we don't really have a lot of dread or really intense feelings about driving in a car. Delayed effects are also something that can really impact how people feel about something. So, a good example of delayed effects are with climate change, for example. So, we've learned from the scientific community that a lot of the effects that we might expect, or a lot of the more intense effects that we might expect, could be years down the road. A lot of them we're experiencing right now, but a lot of the ones that have been talked about in the scientific community for the last 20 years have been talked about as happening in the next 100 or the next 150 years. That effect happening down the road is something that makes it not seem so important and so scary right now. And so that can again affect how people perceive a risk. Media attention, very similar. The more something is talked about in the media, and depending on the framing that the media uses, that can really impact how people think about it. So using climate change again as an example, if it's more prevalent in the media, people are going to be thinking about it more. It will be more on their mind. It'll be part of the general discussion in society, as opposed to if it's not. If there's a lot of media attention over a water contamination incident, that's likely to be something that's top of mind for people, and that will seem pretty scary for people. And then I'll just quickly go through a couple of other things. Catastrophic potential is another thing that really impacts how people perceive a risk, whether they perceive it to be something that's really scary or really risky versus not. So going back to the nuclear power example, it's a low risk activity to live next to or be next to or around a nuclear power plant. They're generally really safe. But if there were to be something that were to happen to a nuclear power plant, the thing that would happen would likely be pretty catastrophic, or could be catastrophic. If we think about what happened at the Fukushima power plant in Japan, for example, so that even though it's a really small chance that that's going to happen, that catastrophic potential is something that can make things seem a lot more scary to people. And the same thing is true with going back to the plane example. It turns out that a plane makes a pretty good example, at least for me. Maybe it's just my personal bias and fear around flying. But the catastrophic potential around planes is another good example of this, where, it's really low risk for you to fly in a plane. It's much safer, to be on a plane than in a car if you're looking at how many people are injured or killed in car accidents every year. But if a plane crashes, there's a pretty large chance that everyone on board will be injured or potentially killed. And that catastrophic potential can really impact that perception. And then the accident history, again, that's something that can change how people perceive risk. So again, we have the 3 Mile Island accident or incident that happened with the nuclear power on 3 Mile Island, which is something that a lot of people still remember. People still remember the Fukushima incident. And so those things really impact how people perceive specific types of risks. If a plane crashed last week, that's going to impact how I feel about getting on a plane tomorrow a lot differently than it will, than I felt about getting on a plane last week or maybe in 6 months. So all of these different things combined together and impact how scary and how severe I think that a risk is for me personally. And these are the types of things that we need to be considering when we're designing risk communications, because these are the types of things that determine how people behave, in addition to other factors as well. But a lot of these risk-specific factors will have an influence on how people behave in the face of a risk. So how do these reactions relate to public health? Obviously, I gave examples of driving in a car and riding on a plane and the feelings that I get differently between those two. But these things also translate into larger public health impacts as well. So climate change denial is an example of this. If we think about a lot of the impacts around, what makes it easy to sort of deny climate change, the fact that it's far off. In the future, at least some people think that, even though we know, there are climate change impacts happening right now. Obviously, there's political impacts and social norms that affect how people think and feel about climate change as well. And also this refusal to wear masks, the emotions and the perceptions around wearing a mask and what it means to wear a mask, whether or not that's effective, and how scary COVID is. Those things all interact to determine whether or not someone's going to decide to wear a mask, which has an important impact, as we know, on public health. The fewer people that are wearing masks when they're interacting with other people, in any sort of gathering situation, is really going to impact in the COVID-19 situation how we're able to control the pandemic or not. And then a good sort of contradiction or comparison in the COVID-19 context is a fear of vaccines, people, being really worried about the vaccine and the potential impacts that it might have, or, not being sure they want to take it, being sort of skeptical, but still participating in social gatherings or the continuation of large crowd events like sporting events or, going to weddings, things like that. Those two things are sort of in opposition to each other. But for some people that, taking the vaccine is going to seem a lot more scary than going to a wedding, which is something before COVID that we all used to do without a second thought. So these different factors really work together to really have a big impact sometimes on public health outcomes.
Yeah, that discussion is a great segue into thinking about how people process information, right? Thinking about, one, how do they react to these public health situations, but how do they, process and understand public health messaging or public health information? And so the next few slides, I'm going to share some theoretical frameworks or theoretical models that help us understand how people receive and understand information, but also how we can develop messages based on where people are. And so understanding how different theories can inform developing really effective messaging. So this theory is called the elaboration likelihood model, and it's developed by Petty and Copchopio. I always stumble on his name. And this is a theory that actually is rooted in the field of persuasion. But don't be confused by what I said earlier, because risk communication is not trying to persuade you, right? It's not trying to convince you. It's providing the information so you can make an informed decision. But the benefits of this theory is that where elaboration comes into context, it really is referring to the extent to which we make a conscious decision to understand information, whether we make great effort or very little effort at all. And so what you see in this particular model, I want to point your attention to the center where it says central root or peripheral root. All right, keep those two things in mind. The central root really focuses on, how people pay close attention to the information that they're receiving. They're being very involved and engaged in trying to understand the information that they're receiving and processing. Peripheral root is more passive, where there's very little effort to really engage or understand the information. So they're not doing a lot of putting a lot of thought into the information that they're receiving. So there's a differentiation between high involvement of processing and low involvement of processing. And there's some components that are related to both. So for those folks who are high on the elaboration spectrum, meaning that they're highly involved in processing information, there's this need for them to be mindful of behavior, attitude, how is this information going to impact me? How does it impact other people? What are the side effects? If I start to, shift into the COVID narrative, what is the vaccine? What are some of the side effects? Who's getting it? That kind of thing. Whereas low involvement or low elaboration, people they don't really need a lot of information. They may go off of what other people are doing. They may be influenced by, people who they look up to, like family members or celebrities, things of that nature. And so elaboration really kind of focuses on how a person receives information and the extent to which they think very seriously or deeply about the information that they're processing. And so the other thing I'll point out on this slide is that for those who are in that high involvement processing or the high elaboration spectrum, they're thinking in terms too about how they've changed their behavior. But I didn't talk about the low elaboration. Some of the things that will really result in this model is that they may change their behavior or their belief about the matter before changing their behavior and thus their attitude. Whereas for the other group who are high involved processing, they're in a different direction. So there's so many benefits of of understanding how people process information and where you might want to intervene with your messaging. That's the point I'm trying to make. Whether you're trying to change their beliefs or attitudes or change their behavior, meeting people where they are and understanding how they take in information is really important. The next slide is another version of the elaboration model, but it kind of like is framed, in the context of a message, right? And so this is a sort of a better way of seeing how people who are central root thinkers or elaborators, they tend to be highly motivated and want to think about the message that they're sending you before they make a decision of whether or not they're going to adopt the message or, act on it. I mentioned earlier, there's this deep processing of some quality elements of the messaging, which we're going to talk a bit more about messaging in a moment. But, as you're thinking about, well, how do I communicate risk communication to people at my organization or clients who receive services from my organization? This gets back to why we said earlier, it's important to know your audience. Think about, if you're wondering, what does that mean though? Think about the people who ask questions, the people who are like, I hear what you're saying, and they're asking more questions to get more information. Those people are highly motivated and interested in the message, and they're thinking about it. So yeah, what is this vaccine? What are the side effects? Where can I go get it? Versus the people who may say, I don't really need to know all of that. I trust the vaccine, I'm gonna get it, right? There are those groups of people who are peripheral thinkers, but then there's the others who are like, no, I don't want the vaccine. And so they're not really motivated to not only receive the message, they're not gonna, they've already made their mind up about the behavior. So this is, like I said, we mentioned that this is an introduction. This is a theory that really should take time to kind of dissect it more. And we do have references for you to visit to get more information. But this is hopefully give you a snapshot of like, people do process information in a particular way. And so on the next slide, we have a list of more, here's another theory I added here. This is the changes of change model, also referred to as the trans-theoretical model. And this is a nice way of thinking about how people respond to a public health crisis. So this is a model that is more of a continuum that people tend to slide, forward, backwards all the time. It's not, necessarily linear, but it's a behavior change model where it shows that, people tend to be in different stages depending on, how they intend to change their behavior. So if you start at the bottom, how you understand this model, start at the bottom at pre-contemplation. I like how they've, set this model up as a stair step, right? So at pre-contemplation, a person is unaware that there is even a need to change their behavior. Or maybe they know that there's an issue, but they just have no intent to do so. And as a theory that has been tested over time for many, many years, the time frame tends to be 6 months, but that could vary. So think about the people who are aware, of the pandemic. You can't not know we're in a pandemic, right? So it's not a matter that they're not aware of the pandemic, right? But they know it's the issue, and then there's this vaccine that's available now. Well, they know about it, but they have no intent on getting it, right? That's one way of thinking about it. Pre-contemplation are those folks who they're thinking about making a change sometime soon, probably within the next 6 months, right? So they're thinking about it. I've been thinking about getting to the gym for like 2 years now. So when it comes to working out, I'm in that contemplation stage. Then the next stage, preparation, this is more around intentions. A person has intentions to take action, right? And I think personally that people can be kind of straddled, across some of these different steps, right? I've been thinking about going to the gym as my example, right? But I do have a gym membership that I'm just throwing money away every month, right? So I've taken steps. I've signed up, right? I just haven't. So, I intend to go at some point. And then as you move through preparation, the next step is action. So this is that person who has initiated change, but they're not consistent with it, So I think about, I don't eat enough salad. is what my partner says, right? So I'll go through a spurt of just eating lots of fresh fruits and vegetables and salads and smoothies, and then I got to have a burger, right? So that action of like being consistent is the key thing there. You change behavior, but you got to be consistent. And then obviously maintenance is pretty self-explanatory. This is a person who has made the behavior change, and they've been, maintaining that desired behavior change for a length of time, ideally about 6 months or more, for it to sort of stick. So this is one way of thinking about, think about the people that you've had conversations with about the pandemic and the vaccine, and where they have sort of, where they may lie on this, in this stair step, based on conversations you've had in terms of their thoughts about the vaccine. For the pre-contemplation stage, we know people who actually have no intention on getting the vaccine, like I mentioned previously. Then there are also people who don't believe that the virus is real, right? So those are people who, they're in that pre-contemplation stage. But for the contemplators, these are people who are considering getting the vaccine. They just haven't done so yet, right? And when we're talking about the vaccine, many times when we're referring to vaccine hesitancy, I think we're talking about people who really are in this contemplation stage, right? I think that term vaccine hesitancy has not been giving its due diligence, and it sort of gives us the impression that these are people who just don't want to get it. And that's not the case. There are people who are interested, but they haven't gotten it yet because maybe they need to know more, right? And so if we move along this stair step to preparation, think of a person who's interested in getting the vaccine and they need to know more about the vaccine, more about the side effects. And so they do some research to learn more and then take action. This would be that person who went out and got their first dose of the vaccine, and they have an appointment set for their second dose, but they didn't go for whatever reason, right? So they didn't maintain that behavior, right? But for the maintenance group, that's the person or persons who are fully vaccinated, meaning they went and got both of their shots. And so thinking about the steps that it takes to get to that point, you got to make an appointment, and you got to show up for your first dose, and then return for your second dose. And as you all know, being in a pandemic, things are rapidly changing, right? And so we can only go off of what we know now. But let's say in the future, if there's a need to get a vaccine on an annual basis, similar to the flu vaccine, right? A person would be considered in that maintenance category if they followed the guidelines to protect themselves. So I wanted to point this out to you all in terms of how we think about theory and its use in public health and in risk communication, because it's very helpful for us to better understand the audiences that we're working with or we're wanting to communicate with. But then when we're getting into actually developing messaging to reach them, we have more information to be able to develop an effective message based on meeting them where they are, right? So, yes, this slide, as I mentioned, those are just a snapshot of theories that we could have spent time talking about. There's a number of other behavioral change theories that we want you all to consider that are very useful for understanding how people consider changing their behavior, and also how we may use those theories to develop messaging. So you have the health belief model. This is a model that kind of thinks about, one's perceptions of their risk for the threat or the severity of the public health issue. Social cognitive theory, that is a pretty robust theory, but one of the key constructs in this theory focuses on one's ability, one's confidence in their ability to take action. And then there's the theory of planned behavior, extended parallel process modeling, and social norms. For the sake of time, I won't go into all of them, but we do have a link on our resource page for you to do a deeper dive. And so I'm going to wrap up my section here, sort of talking about, what does it take to communicate? What are some of those elements that we need to be mindful of? We just spent a good bit of time talking about knowing your audience. I can't reiterate that enough. So once we're clear on our audience and we understand who they are, what they understand maybe, or what their values are, these other important communication elements are really important. The source. So that's like, who is the person who is delivering the message? That's the messenger. Is this someone who is trustworthy? And so thinking about where we were this time last year, our primary sources were, we were turning to the CDC for information as a trusted source for learning about the pandemic, or our state or local health departments, right? But sources can also be individuals in our communities. It can be our doctors. It can be people who actually have lived experiences with the issue. So, for example, right now with the vaccine narrative, people tend to look to other people who've been vaccinated to understand, well, what was your experience like, and how did it go for you? So someone that's trustworthy. And then the actual message, the what and how. When you're thinking about developing your risk communication, you want to make sure that as much as possible that it's evidence-based, using factual information, but you want to present it in a clear, simple way. Don't try to do too much, and the key thing here is to acknowledge what we don't know. We don't know it all. And as I mentioned a moment ago, the pandemic is rapidly changing. So what we know today, may be different tomorrow as we advance in technology and science. So be comfortable saying, I don't know, but, once I learn more, once more information becomes available, we'll let you know. And then the channel, that refers to how you plan to disseminate information to the community. Whether you're doing this through, face-to-face, but, are you using social media platforms, websites? Are you printing material to give to people? That's really important, that you want to make sure that they can access the information easily, and that the route to accessing that information, is to them safe and trustworthy. And again, I've mentioned, the receiver, the audience. Know your audience. Try to understand, what their beliefs are, culture, listen to them. All of these elements impact the way in which we demonstrate trust and impact perception. So now that we've talked about risk perceptions and some essential communication discussions, we're going to move on to discuss specific strategies for effective risk communication.